Hi everyone, good morning. Today we are going to discuss about the nosocomial infection as part of our Fundamentals of Nursing theory lecture. So hopefully you will be able to understand this one, especially nowadays. This is rampant. So the topic is about nosocomial infections. So in knowing this, there are objectives you may learn. First, at least after this lecture, you will be able to define what is nosocomial infections, and you will be able to discuss what are the consequences of hospital-acquired infections. You as healthcare nurses, you'll be able to enumerate what are the sources of infection. You will be able to recognize what are the chain of infection and the factors that predispose to infection. And then what are the causes of the hospital community-acquired infections. You'll be able to discuss this with your patient, the prevention, how to control and be able to manage all the different types of nosocomial infections. And if ever your patient assigned will ask you questions, you'll be able to explain what are the importance of cross-infection organisms that plays when it comes to transmission of infection. And you will be able to discuss what are the types of MRSA infections, and you'll be able to mention what are the types of isolations, precautions, and you are going to perform infection control practices. First, we are going to discuss nosocomial infections and healthcare-associated infection. So what is this? These are a subgroup of healthcare-associated infection, those that originate in any healthcare setting. So example, if you'll be working in the hospital or patient in the hospital. So that's why all the nurses, all the healthcare practitioners were practicing the hand care, hand washing hygiene in order for not to transmit, because they are one of the carrier in transmitting the other disease of the patient to the other patient. Nosocomial infections are also known as hospital-acquired infections. So here, nosocomial infections are classified as infection that originate in the hospital. This can either develop during a client's stay in a facility or manifest after discharge. These nosocomial microorganisms may also be acquired by personnel working in the facility and can cause significant illness and time lost from work. What are the consequences of hospital-acquired infections? The cost of nosocomial infections to the client, the facility, and funding sources is great. This nosocomial infection extends hospitalization time. It will increase clients' time away from work, and then it may cause disability and discomfort and even result in the loss of life. What are the sources of infection? The client themselves or the patient in the hospital. These are endogenous sources, or from the hospital environment and hospital personnel. These are exogenous sources. Most nosocomial infections appear to have endogenous sources. See, for example, we have the E. coli or Escherichia coli. We have the staph or Staphylococcus aureus. And then we have the what we call as enterococci, are common infecting microorganisms. Now, if you can see the table, we have table 31.2, the nosocomial infections. We are going to discuss the most common microorganisms and their causes. See, for example, in the urinary tract, we have the causative agent, which is the E. coli. It will cause improper catheterization technique, the causes for this one. Because of improper catheterization technique done, or there is what we call as contaminations of closed drainage system, this Enterococcus species. And then we have the Pseudomonas, inadequate hand hygiene that will cause urinary tract infection. Now we have the surgical sites also. So we have the Staphylococcus aureus, including the what we call as methicillin resistant strains, or they call that as MRSA. We have the Enterococcus species, including the vancomycin-resistant strains. And then we have the Pseudomonas or aeruginosa. So what are the causes of this? Because of inadequate hand hygiene. We have the improper dressing of chains technique. So nurses should be aware with this one. Before and after every procedure, there should be a hand washing technique done. And we have the bloodstream. The most common microorganisms for this one is we have the coagulase negative or staphylococci. We have the Staphylococcus aureus or Enterococcus species. So the causes for this one, because of inadequate hand hygiene still. We have the improper intravenous fluid tubing and site care technique. So we have the what we call as pneumonia. What is the causative agent that may cause pneumonia? We have the Staphylococcus aureus. We have the Pseudomonas. We have the Enterobacter species. Now it causes because of inadequate hand hygiene still, improper suctioning technique. So nurses, if you'll be having your duty there, now you will be taught in the laboratory how to do proper suctioning technique to avoid this nosocomial infections. We have the what we call as schematic diagram in the chain of infection. First is we have the etiologic agent. So it will go to the reservoir, to the portal of exit, and then the mode of transmission, and then the portal of entry it will go, and then going to the susceptible host. And then that is what we call as the chain of infection. Now next is we have, if we will say etiologic agent, this is the extent to which microorganisms is capable of producing an infectious process. It depends on the number of microorganisms present, the potency of the microorganism, the ability of the microorganisms to enter the body, and then we have also the what we call as susceptibility of the host and the ability of microorganisms to live in the host body. So reservoir. There are many reservoirs or sources of microorganisms, but the common sources are the humans, the client's own microorganisms. We have the plants, you have the animals, or the general environment. People are the most common source of infection for others and or themselves. We have the portal of exit or exist from reservoir. Before an infection can establish itself in a host, the microorganism must leave the reservoir. So we have the chain of infection. After that, we have the method of transmission. So it will leave its sources or in the reservoir. It requires a means of transmission to reach another person or host through a receptive portal of entry. There are three mechanics of transmission. It's either direct transmission, indirect transmission, or we have the airborne transmission. When you will say direct transmission, it involves immediate and direct transfer of microorganisms from person to person through touching, biting, kissing, or any sexual intercourse. Droplet spread is also a form of direct transmission, but can occur only if the source and host are within 1 meter of each other. So we have the sneezing, coughing, spitting, singing, or talking can project droplet spray into the conjunctiva or onto the mucous membranes of the eye, nose, or mouth of another person. This will serve as the portal of exit or entry. If that is coughing, sneezing, so the bacteria or the viruses will go inside through that. So we have the what we call as indirect transmission. It may be either vehicle burn or vector burn. What is this vehicle burn? This is any substance that serves as an immediate means to transport and introduce an infectious agent into a susceptible host through a suitable portal of entry. Examples for this one, we have the surgical instruments or dressings, blood, the serum, the plasma, the water, the food you eat, the toys played by the kids, cooking or eating utensils. So this will serve as an example of vehicle burn. What is this vector burn? This is animal or flying insect that serves as intermediate means of transporting the infectious agent. The transmission may occur by injecting salivary fluid during biting. So the mosquito, when they are going to bite your skin, they are going to inject and then they are going to spread. So, portal of entry to the susceptible host. Before a person can become infected, microorganism must enter the body. We have the skin is a barrier to infectious agent. However, any break in the skin can readily serve as a portal of entry. Here, microorganisms enter the body of the host by the same route they use to leave the source. The susceptible host is any person who is at risk for infection. Any patient or any person is a compromised host is a person at increased risk. An individual who for one or more reasons likely than others to acquire an infection. Example, we have what we call as AIDS. The very young or very old, clients receiving immune suppression treatment, and those with immune deficiency conditions. These are the examples of a compromised host. What are the factors that will increase susceptibility to infection? We have the weather. A microorganism causes and infections are not depend on the number of factors. One of the most important factor is host susceptibility, which is affected by poor state of health due to, number one, advanced AIDS or premature birth. We have the immunocompromise due to temporary treatment. So the example for this one, we have the cancer patient. Somehow they're receiving chemotherapies, they're receiving corticosteroids. We have the antibiotics or any immunosuppressive drugs. That's why the resistance is being reduced or lowered down. They are susceptible to any infections. We have the other one as bad nutritional status, the psychosomatic stress, and we have the convalescence period. So when we'll say convalescence period, this is the time when the patient is okay for home management and then they are about to recover the resistance. So still they are weak. So they are prone to any infections. They are predisposed. Next is we have acute disease. This has increased risk of infection. Example for this one is we have the burns, the trauma that caused the loss of the skin. The skin is open. So the bacteria or the viruses will easily go inside as portal of entry. We have the invasive devices. Example, in the hospital, we have the intubation tubes. We have the catheters, surgical drains. We have the tracheostomy tubes. So in the hospital, these devices, as much as possible, this should be disposables. We have a patient treatment also. What are the causes of hospital, community, acquired infection? Virtually all microorganisms can cause nosocomial infections. We have the viruses, we have the bacteria, fungi, we have the parasites. What are the types of nosocomial infections? We have number one, nosocomial pneumonia. We have the UTI, urinary tract infections. We have the surgical site infections and nosocomial bacteremia. What is nosocomial pneumonia? This is a lower respiratory tract infection. So according to some studies, there are 6 to 10 episodes, over 1,000 hospitalizations. So meaning, if you are going to check and evaluate on the records of the hospital, if there are 1,000 hospitalization, there are at least a maximum of 10 who are having or experience lower respiratory tract infections. This is the leading cause of death. One of the leading causes of death. Nosocomial pneumonia, the early onset for this one is the first 3 to 4 days of mechanical ventilations. Antibiotic sensitive community organisms. We have an example of this is we have the staph pneumonia. We have the S. influenza, and then we have the staph aureus. The late onset, we have the antibiotic resistant nosocomial organisms. And then we have the clinical diagnosis for this one. If suffering from an infections, patient will manifest fever, change in oxygen saturation, and then we have the change in sputum characteristic, and then we have the predisposing factors of nosocomial pneumonia. So a patient is having endotracheal intubation, they are prone to this one, nosocomial infection. Patient from ICU, intensive care unit, patient taking in antibiotics after surgery or any chronic lung disease, advanced AIDS, and immunosuppression. Prevention of nosocomial pneumonia is you are going to do this as nurses. You are going to change positions every 2 hours. You are going to elevate the head at least 30 to 45 degrees. You are going to teach your patient deep breathing exercises for their lungs to be expanded from time to time. Now we have the incentive spirometry, frequent suctioning, bronchoscopy to remove the mucus plugging. Next is we have the second type of nosocomial infection, the UTIs. According to a study, it affects 1/20 admissions, so meaning 5%. So if we have 20 admissions, you will expect now there is one patient there suffering from UTI. 80% related to urinary catheters. So this catheterization is highly predisposed. It will cause UTIs. We have the urine, the WBC to patients suffering from pyorrhea. So there will be an increase of the white blood cells. So the normal values of the white blood cells, we have the MEC, we have what we call as 10,000 to 11 or 10,000, the range for that one. If you are going to see with the laboratory values, you are going to check because there are normal values there stated, and then the indications, the reading of the laboratory technicians, the radiologist, the laboratory specialist there. So to avoid these UTIs, avoid catheter. There should be a septic insertion by trained healthcare workers. Maintain closed system of drainage. You are going to ensure dependent drainage. You are going to minimize manipulation of the system. And then we have the silver coated catheters. The other type, the third, is we have the surgical site infections. In the hospital, infections at surgical site. Within 30 days of surgery, you're going to check whether the patient is okay. Involves skin, subcutaneous tissue or muscle above fascia. This is accompanied by purulent drainage, dehiscence of wound, the organism isolated from drainage. It will manifest fever, erythema, and tenderness at the surgical site. So, if you are a nurse, your nursing management here is you are going to limit the pre-operation hospitalization. Stabilize underlying diseases. You are going to avoid or encourage them hair removal by shaving, because this hair will invite this is the nice place, the shelter, the breeding place for bacteria. So you're going to clean this up. Clipping of skin is prepared. We have the skin decolonization. We have the impermeable drapes, and then we have the maximum sterile barrier precautions. The next type of nosocomial infection, we have the bloodstream infection. This is attributable mortality 20%. The risk factor is the intravenous access devices. We have the central venous catheter. This may happen during catheter insertion. Contaminations of hub catheter junction. Contaminations of infuse set. Heavy skin colonizations of the insertion site, internal jugular or what we call as femoral or vein sites. We have the duration of placement and contaminations of the catheter hub. What are the preventions of this nosocomial? Limit durations of use of intravascular catheters. There's no advantage to changing catheters routinely. Second, Maximal barrier precautions for insertion. You are going to use sterile gloves, gown, mask, cap, any full-size drape. There should be strict disinfections of catheter insertion site. And what are the importance of cross-infection organisms? Okay, we have the MRSA, the methicillin-resistant staph aureus, and then we have the VRE, the important cross-infection organism. Number one is we have the MRSA, the methicillin-resistant staph aureus. This staph aureus is resistant to methicillin and usually others. This is a common nosocomial infections in hospital. It appeared in 1980s, some epidemic strains, long-term care facilities. The carriers here is not necessarily ill, but it is easily transmitted by healthcare workers. This may cause infection, bacteremia, skin or soft tissue infection. We have the UTI, pneumonia, and others. What are the colonization common of the MRSA? We have the nose, the axilla, we have the perineum, we have the wounds or lesions. Then from this, it is spread by hands, the fomites, the aerosols, and then it becomes more common in the community. What are the types of MRSA infection? The community acquired. The most affected population groups of this are those in a close person-to-person contact environment and poor hygienic condition. Example for this are homeless people. We have the prisoners, the military personnel. Now, in this environment, the community-acquired MRSA infection is common. But we have an example of the hospital-acquired. Usually, it causes bacteremia and systemic infections in older and ill patients. So, we have the prevention. How to prevent this one? Decontamination of surfaces, the materials, the clothes, the equipments, or any keyboards, any mobile phones and hands, this will be decontaminated. So, decontaminations will be done. Before admission of a new patient to an inpatient ward, this will be taken from any skin wounds or breaks. We have the catheter parts, anterior nares, throat, and perineum. Once a patient is in the culture positive of MRSA, all staff must be screened. Staff with wounds, skin lesions, or eczema are suspended, awaiting results. If they are negative, it's okay. They are going to continue. They can do the work. And then we have the screening of other patients and staff, isolation, and barrier observation. These are beneficial effects of mouth protection. You're going to wear the face mask, gown, and hair covers when entering to the affected patient room. And the important one is we have the hand washing technique, hand hygiene. We have the drug of choice for this one is vancomycin. So regarding vancomycin, what are the mechanisms of action? You are going to come up with a drug study on this one. This vancomycin, resistant enterococci. This is an Enterococcus faecalis and E. fecorium. Normal inhabitants of bowel and female genital tract. It persists in the environment. Long periods of time, up to 7 days. The hands, the gloves, the equipments and surfaces. This can cause UTI and wound infections. How to prevent? How to control? So we are going to discuss the prevention, the control, management of nosocomial infections. There are 5 pillars of infection control. Number 1, isolation and barrier precautions. Second, decontaminations of equipment. Third, prudent use of antibiotics. And then fourth, hand washing. And fifth, we have the decontaminations of the environment. So in prevention, control, and management of nosocomial infection, you are going to practice basic principles of medical and surgical asepsis in patient care. You know, this were discussed already when you were in second year level, Funda, what we call as surgical asepsis. You are going to practice the principle of aseptic technique, reducing environmental hazards through hand washing and or use of alcohol, personal protective equipment. We have the gloves, you have the gowns, you have the mask, you have the protective eyewear you are going to use if necessary, isolation precaution, and surveillance. What are the goals of isolation? This is very familiar to all of you, isolation. The goal for this one is to prevent transmission of microorganisms from infected or colonized patient to other patients, hospital visitors, and healthcare workers. What are the types of isolation precaution? We have the standard precaution. This is applicable to all patients. You are going to replace universal precautions. We have the transmission-based precaution. This is for patients with documented or suspected infections. The three types for this one is if the patient has the history of airborne, droplet, and contact. Types of isolation, we have the airborne transmission. Now, in addition to this, we have the standard universal precautions in every transmission. If that is airborne transmission, that requires negative air pressure room. There should be strict. Now, this is spread by both airborne and contact routes. When you will say airborne transmission, the portal of entry, exit here, respiratory. We have the droplet transmission, droplet pediatric respiratory. We have the contact transmission, contact or enteric or any vancomycin resistant patient. So the best precautions, easy, inexpensive, and this is taught in every people in the world. So for example, we have the hand hygiene. This is the single most effective intervention to reduce the cross-transmission of nosocomial infections. What are the new technologies to have this, what we call as management or control of this infection? Hand hygiene, we have the waterless antiseptic solutions can use for that. We have the antiseptic impregnated central venous catheters. And then we have also the antiseptic silver impregnated urinary catheters. It may be closed system, Foley, urinary catheters. We have the chlorhexidine gluconate for the patient's skin and antiseptics, CVC replacement, peripheral IV placement, and then we have the phlebotomy. So, class, we are done with the topic about nosocomial infection. Aside from this presentation, video lecture that I have done, now this may serve as our virtual learning online. Please keep an eye with this one. Start watching, listening, and understand from the first beginning to the end. But aside from this, don't rely much more on the PowerPoint presentations or any uploads. Give time to study more in books, or you're going to browse through hybrid library in order for you to be a better nurses someday. So, best wishes. Bye-bye. Thank you.